Dr. Matt from LifeWorks Integrative Health. And in the next part of our video series of how to prevent knee replacement and knee pain and really preserve your joints, I'm going to be talking about what happens when we start to get the imbalances with the muscles within our legs. If you didn't see our first video, go back and check that out. The previous one where it talks about what the normal anatomy of our muscles should be in our legs and how when those begin to tighten on one side and weaken on the other, we start to create a rotation. So you see, for every tight muscle, your body's going to react with a weak muscle. So the reason why that the body tightens in one area is because of weakness in another. And that's what we start to see with people with chronic knee pain, is that the lateral side of their leg, all of these muscles become overstimulated, overreactive, very tight, because all of the medial muscles on the inside, or these glutes that run the external rotation, become very weak. Now, what are some of the things that causes this weakness to happen in the body? Well, one is sitting. We get what's called glute amnesia, where our glutes are not firing properly. And when these glutes don't fire properly, the other muscles are going to begin to pick up the slack for that and overcompensate as time goes on. So that's one reason. Another reason why we become imbalanced is because of injuries to our ankles. When we sprain an ankle and we have this inversion sprain, it causes damage to the muscles along the lateral side, which causes imbalances all the way up and creates tension on that knee. So what happens now that we've got external rotation of the femur going this way, internal rotation of the femur going in, and external rotation of the tibia. So let's take a look at this. One, we know that there's imbalances within the muscles. So when this happens, we start to get the angle of the knee begins to change. This starts to put pressure on that meniscus over time, wearing it down. It also, that kneecap that is sitting here now, starts to track differently. And rather than going straight up and down, it's now rubbing it outside of that groove, breaking down that tissue. Now, what are our standard medical treatments for this? You go to the doctor and, doc, I've got pain in my knee. So what are they going to do? Most of the time, they're not looking at the biomechanics of the knee. The first thing that we typically do is we start taking Nsaids. Okay? Nsaids are going to decrease inflammation, absolutely, but is decreasing the inflammation fixing the structural issue that is actually going on within the joint? No. So long term, this isn't a good solution for people with joint pain because you're not correcting the root cause of the issue. The second thing that people will sometimes put in there is what's called cortisone. And some of you might have had cortisone injections into the knee or into other joints of the body. Now, if you've seen the research on cortisone, cortisone is actually very damaging to joints. Cortisone is acidic. And so what happens is when the cortisone becomes injected into that knee, it will soften and weaken this meniscus as well as the articular cartilage, which is setting you up for more degeneration and progressing you faster down more decay and bone degeneration within that knee. A study that came out from the Journal of American Medicine, they took 140 people, and what they found was those that used the cortisone injection, the 70 that used the cortisone injection compared to the 70 that used the placebo, those that used the cortisone injection had 2.5 times more degeneration within that joint than doing nothing at all. So I don't recommend people using cortisone as their first or really maybe even their second option. Then we get into what's called hyaluronic acid, okay? Now, hyaluronic acid is something that's found naturally within your joints. It's a lubricant to help cushion those joints on the inside. So one of the things that we do here at LifeWorks is we commonly use hyaluronic acid because as we start to correct the biomechanics of the knee and the muscles, we now want to provide more lubricant into the joint so that the joint moves fluidly. Now, there may be a time that you do need surgery. That is a possibility. Orthopedists that we refer to and we've talked to, typically only about 10% of the people that come and see them actually need surgery for their knees, surgery for their joints, meniscus, ACL, MCL, joint replacements, only about 10% of the time. So I want to make sure you understand all of this first so that you can make an educated decision and going down the proper line of getting your knee pain corrected. So here's where we have a valgus deformity, and this is going to degenerate this further. So on the next video, we're going to start to show you how we begin to correct this.